Hi friends, today's topic of discussion is odontomes. They are actually odontogenic tumors, but because of their slow growth rate and low recurrence, they have been called as hamartomas, which mean they are abnormal tissues but native to the site. These are most common odontogenic lesions arising in the first 2 decades of life, and they are asymptomatic. They are actually recognized during routine radiographic examination. If a patient comes to you with an unerupted tooth, you make a radiograph and you will be seeing the reason for the uneruption of the tooth or impaction of the tooth is probably the odontome. So it is associated with an unerupted tooth. Next is you have two types of this, central and peripheral, and these lesions arise from the odontogenic tissues that are dental lamina cells. Now, at an early stage, you can have basically epithelium and mesenchymal tissues in this lesion, whereas at a later time, you will be seeing all the hard tissues such as enamel, dentine, cementum, and variable amounts of pulp tissue as well. Because of variety of tissues that we see in odontomes, they have been called as composite odontomes as well. These odontomes are further classified as compound odontome and complex odontomes. Now, what are compound odontomes? Here we will be seeing the structures as multiple small tooth-like structures in the lesion, whereas in case of complex odontome, it will be a conglomerate mass of calcified material, which is composed of enamel, dentin, etc. Compound odontome is most commonly seen in association with anterior maxilla, whereas complex odontome is in the posterior region of either jaw. Now, radiographically, when you see, compound odontome will show small tooth-like structures with kind of crown and a root kind of architecture, and they are all grouped in a mass like this, and lot of radio densities inside this zone, which have radio density similar to the tooth structure and surrounded by a radiolucent rim, whereas complex odontome will show a big mass, a conglomerate mass, a complex mass of radiodense material. This radiodensity is similar to the tooth structure, and that is also surrounded by a radiolucent rim. This is the radiographic appearance of odontomes, compound and complex odontomes, and when the tooth is impacted, which is the odontomes will be sitting on top of them, and those are also very clearly appreciated in the radiograph, and this will be the reason for the uneruption or the impaction of these teeth. Now coming to histopathologic features of odontomes, we will learn them separately: the compound odontome and the complex odontome. compound odontome, as we saw clinically and radiographically, you will be seeing multiple tooth-like structures, quite a well organized tooth-like structures in loose connective tissue stroma. Whereas in complex odontome, you will be seeing this calcified material as a mass which has enamel, dentin, cementum and variable amounts of pulp tissue. Even in compound odontome, you will be seeing all these hard tissues, enamel, dentin and pulp, but in a very organized way. Here it will be quite complex in complex odontome. And you will be seeing also odontogenic epithelium, but very prominently this odontogenic epithelium will be seen in complex odontome. These tooth-like structures, when we see in the histopathology slide, we will be seeing them as rounded masses, all probably cross-sectioned, with the central pulp tissue and peripheral dentin, and they are capped by enamel space. This enamel is lost during decalcification, so you will be seeing wherever the enamel was there as the space, and this space in some structures you will be seeing the enamel matrix. Some remnants of enamel matrix you will be seeing in these spaces, and in between you will be seeing the stroma, connective tissue stroma with fibroblasts and few blood vessels and some odontogenic epithelial cells. So this is the dentin, pulp space, pulp tissue and the enamel space and occasionally enamel matrix, and this will be the stroma which may have odontogenic epithelium. And here this one lesion, compound and complex odontome, are associated with ghost cells. In compound odontome, it is 3% of the times you will be seeing the ghost cells. On the other hand, in complex odontome, the entire hard tissue mass will be seen as a conglomerate mass consisting of a big mass with clefts and in between some pulp tissue spaces. So you can see a mass like this. Here this is all the dentin, showing the mature tubular dentin. This is dentinal mass. This will be the enamel space here, and probably here. These are all the enamel space which may also contain the enamel matrix, and here will be the stroma, and this stroma consists of odontogenic epithelial cells, and this will contain 16 to 20% of the times it may have ghost cells. Now this is dentin, this is the pulp tissue space, this is the enamel space, and here also you may see the odontogenic epithelium. This is the odontogenic epithelium, and here in complex odontome, 16 to 20% of the times you will be seeing the ghost cells associated with odontogenic epithelium. Now all this tissue is basically mature tooth tissue. Now I hope it's clear to you that this mass of tissue in compound odontome is very well organized with tooth-like structures resembling the anatomical structure of the tooth. Here in case of complex odontome, it is just a mass of calcified material not resembling any anatomical structure, and because of this organized arrangement it's called as compound odontome, and because of this disorganized conglomerate mass it is called as complex odontome. And both these lesions are removed by enucleation if they pose problem, if they cause impaction of tooth which is really needed in the oral cavity. And If not, if they are between the teeth and they are asymptomatic, they are just left behind. As always, to draw the histopathology diagram, we need a pencil to draw the circle and eosin and hematoxylin pencils to draw the diagram. Now we'll start with compound odontome, where first we will make all those small tooth-like structures, as we have already learnt in the theory part that it is a very organized mineralized material. And now in the center we will make the space which will be occupied by the pulp tissue. Some material, some tooth-like structures, we will just leave it as it is without the pulp tissue inside. Now we will make the dentine part. So we'll just draw radiating lines, not very obvious ones, but definitely when we finish it should be appearing as if they are dentinal tubules and they are radiating from the pulp surface. Once we finish this, we just will darken the outlines, inner and outer outlines. Now we shall be making the caps of enamel spaces, and in some spaces we will be drawing the enamel matrix. Most of these are empty because the highly mineralized enamel is lost during decalcification, but in some we will be doing the lightly stained enamel matrix with the hematoxylin pencil. Now we'll be doing the loose connective tissue stroma, and we can also draw a thin capsule material which will give the radiolucent rimming radiographically. And now I'll just fill it up with ground substance. In between I'll just make few blood vessels. Now I'll make few fibers, collagen fibers. The description as it goes is loose fibrous matrix, fibrous stroma with few fibroblasts. Now we shall make the nucleus in these. Once we finish everything, we shall just do a little pulp tissue inside the spaces and put some nucleus inside. We can also do the odontogenic epithelium, a few rests here and there, but we will be doing that in the complex odontome. So let's start labeling compound odontome. This is the enamel matrix. You can see it here. This is the dentin. This is the pulp tissue. Then we have enamel space. We have fibrous, loose, fibrous connective tissue, stroma around it. We can also label all these structures as multiple small tooth-like structures. These tooth-like structures are composed of enamel matrix, dentin material, pulp tissue, enamel space, all this placed in loose fibrous connective tissue, stroma, and that makes it an organized odontoma and hence called as compound odontoma. So this is compound odontoma. Now let's draw the complex odontome, which again needs the same Yosin and hematoxylin pencils. Have kept two Yosin pencils, one to draw the odontogenic epithelium. We need a sharp pencil which is ready. So let's start drawing the complex odontome. Here we will be just drawing as we have discussed that it's a conglomerate mass, so an irregular mass showing lot of clefting and enclosing few hollow spaces, and another small area like this. Okay, and here inside it is all the dentin material. Now we have filled every part. We'll just darken the outlines, inner and outer outlines, like we did for the compound odontome. Now we'll make some spaces for the enamel. In these clefts we will see the enamel spaces and the matrix. Here like this, and because the enamel is highly mineralized material and all the tissues that are formed in odontome are quite mature, the enamel matrix gets lost during processing, hence we just see it as enamel space, as I've already told in compound odontome, and a minimal amount of enamel matrix you can see in enamel spaces occasionally. And in these areas you'll be seeing the pulp material, and here is the enamel material, and it is a disorganized way of forming calcified material in complex odontome. Now we shall be doing the odontogenic epithelium. Sometimes above the enamel space we will be seeing remnant of the ameloblast like cells, and here we'll make the odontogenic epithelium. Okay, we can do some cells here too. Now we shall make nucleus in these cells. Now we'll make the connective tissue stroma. In these epithelial cells, around 16 to 20% of the times we see ghost cells too. So if you wish to make ghost cells, you can just do them in the epithelium. Draw a little bit more of epithelium and do the degenerating epithelial cells. Those are the ghost cells. And we'll make some amount of pulp tissue too. The calcified material in complex odontome, we will not be seeing it resembling any anatomical structure. So it is quite haphazard, irregularly formed mineralized material. But it still has all the structures as in dentin, enamel and cementum-like material and the pulp tissue. Now we shall make fibroblasts too and make nucleus in them. We can make the blood vessels, 1 or 2. And make endothelial cells. This kind of completes the drawing of complex odontome. Now let's start labeling complex odontome. So this is complex odontoma. Here we can start with enamel space, dentin, pulp tissue, we can label the enamel matrix, here are the odontogenic epithelium, and this is the connective tissue stroma. We have forgotten to draw the nucleus inside the pulp tissue, so we'll just draw nucleus in the few cells that we see in the pulp tissue. This finishes the drawing of both compound and complex odontome. You can just see that the dentin material is tubular because these are mature tubular dentin, and the stroma and the pulp tissue and the enamel space with enamel matrix, and here are the odontogenic epithelium. This is the compound odontome. You can see that this is quite organized, and whereas in complex odontome it is very disorganized arrangement of mineralized material. I hope this helped you. Please share your comments in the channel. Please like the video and please subscribe to my channel. Thank you very much. See you all soon. Bye.